NBC4, the Tri-State News Channel. And now, Chuck Scarborough, Sue Simmons, Janice Huff, and Len Berman. This is News Channel 4 at 11.
A laser that promises to be the most gentle treatment on the market. Later, Dr. Max Gomez with the latest laser procedure to correct vision. News Channel 4 at 11. We'll be right back.
Also news for your health, the latest eye laser surgery that promises to do the job easier than ever.
And laser surgery to improve eyesight is increasing in popularity, but many people don't realize it still involves cutting the eye.
Now there is a new laser technique that does away with the knife, and Dr. Max Gomez is here to show us how this works. Max.
That's right, Chuck. Darlene, popular indeed. Laser vision correction has been done 4 million times in the past few years with a remarkable degree of success. But when there are complications, it's most often related to the part that's not done with a laser. New technology now uses lasers to do the entire procedure.
Wearing contact lenses just ended up, becoming a hassle.
I was getting red eye, irritations.
It was causing my eyes to be extremely dry and very irritable.
I just got really, really tired of the routine. Finally decided, let's get rid of it.
So like millions before him, Michael Marich decided to go for laser vision correction, called LASIK, to get rid of his glasses and contacts. Now, the first step in the surgery normally involves using a very accurate steel blade to cut a very thin flap in the cornea so that the laser can reshape it underneath.
A blade just sounds rough. It sounds like it's going to hurt. It sounds like it's going to be painful.
More significantly, the blade is the main source of rare but troublesome complications, such as abrasions and...
When you lay the flap down, when it's made with a blade, it may not stay in the same position. It may move, or the patient may move by rubbing his or her eyes, and which you get like wrinkles in the flap.
But now there's a way to make the flap without a blade, using a new laser that first creates tiny bubbles inside the cornea and then cuts around the edge in a very precise manner. That's what Michael chose. You can see the bubbles forming as the laser scans across his cornea. A second laser then does the actual reshaping that will correct his vision.
That's great.
Greg Gaspering had it done just 11 days ago.
So it was very close to 2020, and that was I think it was 5 days after the operation. It has gotten better since then.
So what are you looking forward to?
Going to the beach, going to the pool, water parks, not having to worry about how long the lenses have been there, if I've got no solution, if I forgot to get the disposables, if I have to go back and pick them up.
Now, because the laser makes a more precise cut, the increased safety margin means people who might not have been candidates for LASIK because of thin corneas can now have the procedure. But new technology costs more. The all-laser LASIK runs between $4,000 and $5,000 for both eyes. And in the interest of full disclosure, Dr. Dello Russo is the one who did my laser surgery, probably 8 or 9 years ago now.
How are the eyes?
Well, terrific. I still need reading glasses, but I would have needed them if I was wearing contact lenses, so I'm ahead of the game.
Okay. Thanks, Max.
Thanks, Max.